Welcome to The Buzz, where we bring you leaders in dental education discussing hot topic courses and industry trends. I'm your host, Vanessa Emerson, and I'm honored and pleased today to bring you Dr. Sam Lau. Welcome, Sam.
Thank you. Thanks for having me.
It's my honor, truly, and I anticipate that many event planners already know and or have worked with you, and considering, in fact, that you've spoken in every state in the country, and I'm sure some places outside of the country, have, for many years. But for those who may not be as familiar with Dr. Lau or his programs, that's the purpose of this video. Let me just give a brief introduction, a couple of high points from a long list of honors and awards and experience that Dr. Lau brings, starting with 35 years of private practice experience in periodontics and implant placement. He's also past president of the American Academy of Periodontology, a Professor Emeritus at University of Florida. Florida's a great place to be, College of Dentistry. And also an associate faculty member of the Pankey Institute for 25 years. As I have been in the industry for 20 years, I know that over the years, I've heard so many times people mention your name, and always with love and respect. And so thank you so much for what you've done for our industry and the many years of educating dentists and teams. And could you just share with us, Sam, a little bit? I know we have multiple courses that are both lecture format. I know yours are very interactive lecture, but lecture compared to hands-on workshop format. For the event planner who's not familiar with what you offer, tell us a little bit more about your topics and what's it like to work with you? What would your audiences expect?
Well, yes, I have. I've mentioned in the past that I started out teaching high school biology before I went to dental school. That is a tough audience. Dentists and hygienists are easy compared to that. It was never my idea to get involved in dental education to the degree, but it's in my blood.
Weekly events. My
parents were teachers. My grandparents were teachers, and so it was just natural that that I would move into that. And and I'm a periodontist, so many of my courses are somewhat related to perio, but then I began to branch out. And as I branched out, I began to look at, a baby boomer. I began to look at even the offshoots, including now very popular implant disease. And so, but I think the thing that I really branched out on was team interaction, how you work together. I was naive at the beginning. I thought if I showed a dentist something, that it was going to happen. I thought if I showed a dental hygienist something, it was going to happen. But then I realized that what I really needed was everyone there. And so my titles begin to change. My learning objectives begin to change to where I wanted within that 2 or 3 hour capsule, whatever it is, or many times 6 hour capsule, that I was hitting the needs of everyone. And so you'll notice that when I do present, I will pause. In fact, some folks say that I pause quite well. I do pause, and that pausing is for you to listen and digest.
Yeah.
So after a while, I have a good cadence to this. But I'm blessed because folks will say, I can't believe we were there for 2.5, 3 hours. But I do challenge the audience. I do not believe in, I have really a passion against loading a room up with a PowerPoint. To me, that is the worst, and you'll hear me say this in my programs. That is really not the way this is. Now, I'm not going to walk out in the audience, although I have disdain for podiums. So if you ever get me, you don't have to worry. You will see no podium. I will walk amongst the group. Now, I'm not going to embarrass your participants, but I know how to interact with them.
Yeah.
And I will ask them questions. So I'm in the audience, I'm talking with them. I want this to be what? an experience. Yes, I can I can do jokes well, and I do get laughter, but it's not more. It's more than just entertaining, isn't it? Because there are some folks out there that are great entertainers, and while you're there, you love it. But when do you go back to the practice? Was there's pearls that you were able to take back? So it's a blend. A consummate
Sure.
speaker is an easy thing to do.
Sure, that's great. Now, as far as topic, then in the area of periodontology, I'm assuming, but could you give us a little more of an idea of what are you typically requested to speak on, or like why would meeting planners typically come to you? What topic or what problem are you solving?
The number one pain point in a dentist when it has anything to do with perio is how do I put it into the practice? How do I put it into the practice? Sam, just tell me how to do it, because I also do perio consulting. I want my patients to have the highest quality of care. I want my team to be happy, but I've also got to make money. Tell me how to do it. And that is the number one topic that I do.
So,
I've heard it too many times, so we do it in a very practical nature. We do to a certain degree in entertaining, but what does the hygienist do? What does the patient greeter do? What does the dentist do? But it has to be meat. I know. I will also say one thing that I haven't mentioned. The number one area that folks always say to me, including the meeting planners, thank you for being candid. Thank you for being straightforward. Thank you for not dancing around. I appreciate you understanding us, but telling us real to real what you think and what we need to be doing. If there was one thing that I get as thank you for being you.
oh,
And I will tell you, I didn't start out that way. I don't think anyone did. I
sure.
would, I was too, oh, I don't want to offend. Now, please, I am not going to use profane. I'm not going to be,
Yeah,
but
because you correct and deliver.
exactly.
Yeah. That's awesome. No, you're too classy to do anything other. That's great. So before we wrap up, just want to point out for the event planner that we have multiple other interviews recorded that go specifically off into individual topics. So you'll find at Dental Speakers Bureau when you pop open the course description. So Dr. Lau talks more specifically about those courses. So this purpose of this interview is to keep it kind of high level. But before they go dive off into those individual courses, Dr. Lau, is there anything that would be important for them to know about working with you, or that you'd like to leave us with today before we wrap up?
Well, having been in your shoes, I'm very receptive. We pivot. We are able to be user friendly for you. Now, I have certain principles that we all do, but for the most part, if I'm not out there speaking, then what good is it? I mean, if I'm not able to deliver, so if I create challenges for you in having me, then that doesn't help either one of us. So I'm there to help, to make sure that it meets. It's selfish. I'm here to meet your needs. I'm here to meet your needs, and we have the number of courses tried and true over the last 2 or 3 decades. We know what hits. We know what doesn't hit. We're able to be versatile.
Oh, I love that. And I'll just add an addendum to that. I know you mentioned to me that you have 10 years of meeting planning experience yourself. So it's wonderful when you've already walked in the event planner's shoes, that you understand their world and the fact that they're juggling a lot more than just getting a speaker.
Oh yeah. Oh yeah.
Thank you for making it easy. Well, there you have it, y'all. So please visit dentalspeakersbureau.com to learn more about Dr. Lau's presentations. You can also visit his own website at DrSamLow, DrSamLow, LOW.com. You can email info@dentalspeakersbureau.com to reach me. I'd be happy to help connect you. And I really encourage you to reach out to Dr. Lau. Not only will he bring you exceptional education, but I know that having him there will be a draw for you as well to help you get bums in seats, which is what we're always looking for as event planners. So thank you so much, Sam. It's been a lot of fun to spend some time with you today. And thank you for being here and sharing with us.
It's been a pleasure. Thank you, Vanessa.
Everyone take care, and we'll see you next time on The Buzz. Be well.